Hello, my name is Dr Jenny Gowan. I'm a consultant pharmacist. I work a lot in aged care, also in community practice, and also do a lot of medication reviews for people with particular medication needs. The presentation we're going to go through is an interesting one because it's going to be more looking at the devices. So it's going to be asthma and COPD devices. I also work on the Education Writing Committee for the National Asthma Handbook. The learning objectives of the presentation is to look at the different classes of medications used in asthma and COPD and the importance of the correct device technique. But probably the most important message is to get the right device that suits the person so they will use it. So we'll be emphasising that, and you'll be amazed at the amount of devices that are around in the different products. So let's firstly have a look at the classes of medication so you get that sorted out in your mind, and then we'll go through the actual demonstrations of them. So there's relievers and preventers. Years ago, you might have heard of controllers, but controllers have now been taken out and just keeping it simple down to relievers and preventers. So you've got the short-acting beta-2 agonists as the reliever, then you've got your preventers, which are non-steroidal. They were generally inhaled corticosteroids or long-acting beta-2 agonists or muscarinic antagonists. And then there's a few other medications for those people that have really severe asthma. This is an excellent summary of the asthma and COPD medications put out by the National Asthma Council. It is available on the website. It will be updated in the near future because there's about 5 more products. So watch for this space. You can download it yourself onto an A4, or you can request from the website a lovely big poster of it, which is really good for your practice, and it really helps to explain to patients and to other nurses what's going on. So let's have a closer look at them now. The relievers, which are known as SABAs, the short-acting beta-2 agonists, they are used as an as-needed basis for emergency plans with it. They actually act on the muscle. So they relax the muscle, they work within minutes, and they will relieve the symptoms of asthma by the relaxation of that muscle. And many of you would know the various brand names that are available. Sometimes people might find they get side effects from them, such as tremors, shakes, and palpitations. Hyperactivity in children rarely occurs when they're using the inhaled SABAs. It used to occur far more frequently when we used to use the Ventolin syrup, but that's no longer used these days. Okay, so moving on to the preventers. So with the ones like the Ventolin, they actually relax the muscle, but they do nothing on the inside. And you can see the diagram that is there that shows you that there is the thickening of the actual airway inside, and that's where the inhaled corticosteroids act. They're all listed for you there. The non-steroidal ones, like the oral montelukast, used to be available as Singulair, but that's no longer available now. It's only as a generic. They actually stop the leukotriene cascade, their antagonists there. So they are used in some cases. There are only pharmaceutical benefits for people under age 15, but some adults with severe asthma may be on those, but they would have to pay. As I mentioned before, products such as Tylade and Intal are now discontinued in Australia just recently. That has occurred. Few side effects with the inhaled corticosteroids. Sometimes people get a throat irritation, difficulty in talking, the dysphonia, and oral thrush. That is minimised by using a spacer and also rinsing the mouth out after use. With long-term use of those, you can develop cataracts, but then if you get old enough, most people develop cataracts anyhow, so I don't see that as a big contraindication. But certainly we need to be very conscious about prevention of osteoporosis with long use of inhaled corticosteroids. So making sure vitamin D levels are right, calcium's right in the diet, that you get the calcium from the diet preferably, and actually having a bone mineral density. So we try and use the lowest possible doses of the preventers. So now talking about the LABAs, which are really like a long-acting Ventolin type product. So they should only be used in asthma with the inhaled corticosteroids. They are usually taken regularly to reduce the symptoms, and you've got the products named there as well, which we'll go through a bit later as well, and the side effects similar to the relievers. What you see in asthma is the combination of the inhaled corticosteroid and the LABAs together, and all the products are named there for you, and we'll go through using the different devices. So they've got different combinations of salts with them as well. You've got the fluticasone propionate and the serotype, but you've got the fluticasone fureate and the brio, and they are different. Some of them are twice a day, some of them are once a day. So again, the same sort of side effects as you would expect with the inhaled corticosteroids. So then, if you're still not getting control with the use of the inhaled corticosteroid LABA combination, there are a few examples where people might need to use a LAMA, and usually they are only used in the COPD. But as far as asthma goes, there's some that are listed on the PBS for asthma. Interestingly, Atrovent, which many of you may know, that one is usually used in emergency, and those of you who work in hospital emergency departments. So that is for PBS for asthma. The other one, which are the Spiriva Respirmats, those are approved for use with asthma. Interestingly, the old HandiHaler is not approved for use with asthma. It is only for COPD. But some of you might be really up with it and say, well, what about the person with COPD asthma overlap? Yes, well, that then would be approved. So you've got the combinations now, moving on to the COPD, which is the chronic obstructive pulmonary disease, which is the usual term that we use in Australia. Some other people might call it CORD, chronic obstructive respiratory disease, or chronic obstructive airways disease, or CAL, chronic airways limitation. Depends which hospital and where you did your training and what happens then. So the COPD only, you either use a LABA or a LAMA. So that was the LABA, which is like your long-acting Ventolin, and your long-acting antimuscarinic agent, which is your tiotropium. But then there's a number of others now. And as I mentioned, the ones with the LABA have got the OL. So you've got vilanterol, indacaterol, olodaterol, and then you've got formoterol. All those are long-acting beta agonists. Got it? Hopefully that's a clue that a lot of the prescribers go, hadn't thought of that. Umeclidinium is a LAMA, as is glycopyrronium, as is tiotropium and axolidinium. And they also dry up secretions as well as causing a bronchodilation. So now we move to the triple combination where you've got the 3 and the 1 inhaler. And those of you that are nurses will just love this because it's 1 inhaler to give it to your resident if you're in an aged care home, or a patient if you're in a hospital, or those of you that are nurse practitioners if you're prescribing it. So you need to make sure that we don't double up with those. So you've got your trilogy once daily maintenance for those with moderate and COPD. Whilst it's TGA registered for asthma, at this stage it is not PBS listed, but it may be in the future. You've also got the new one, the Timbro, which is the combination, again, of the beclometasone, which is an inhaled corticosteroid. You've got formoterol, and then you've got glycopyrronium. So you've got your inhaled corticosteroid, your LABA first in that one, and then your LAMA, as I've listed them there, in a metered dose inhaler. So for those that suits the metered dose inhaler, that's an option for you now. You've also got in the combinations of the Breezhalers, NZ Air, which is a once daily one with the triple therapy as well. Okay. So, and then you've got Breezetree Aerosphere, which is just coming on to use, a metered dose inhaler again, 2 inhalations twice a day for severe COPD. Again, you've got your inhaled corticosteroid, budesonide, glycopyrronium, which is your LAMA, and formoterol, which is your actual LABA, which has extremely fast onset of action. Other medications that you might encounter are the oral corticosteroid medications, usually for severe flare-ups of asthma or COPD, and for severe asthma medications, which are prescribed by a specialist and administered by injection. They are add-on treatment, and you've got a number of those depending on the indications, which one is the most appropriate for these people. And the listings have now increased. The omalizumab is for over 6 years, and the others are all for over 12-year-olds. The asthma handbook and it explains the mechanism for prescribing. So have a close look at this in your own time. You won't be able to probably spend time when you're viewing this now, but all patients should have a reliever therapy for emergencies. There are very few patients that should rely solely on SABAs. Most patients will need to have a inhaled corticosteroid on a regular basis and then a SABA, or there is a new therapy where you can use the combination as a as-needed basis. So level 2 is where you're going to see most of your patients. So you've got your regular daily maintenance of your inhaled corticosteroid and a low dose and your short-acting beta agonist to open up the airways as needed. And what's coming over the last few years is the combination of budesonide, which is an inhaled corticosteroid, and formoterol, which is a long-acting beta agonist but acts as fast as the SABAs, and that can be used in an as-needed basis. You've also got moving up to level 3, where you would use that on a regular basis and as necessary. But caution, it is only the low doses of that product that are approved for that type of use. So now you've had the overview, which was a very, very brief overview of asthma. There are other videos available on the Ausmed website which go into far more detail about going through the selection of the product, of the actual ingredients. You've also got to look at the actual devices, because you need to make sure that you get the right device that the person is going to use.